Sir, over to you.
Thank you, Dharmender, and good evening, everyone. Today, I've been given this opportunity to briefly speak upon fatty liver. As we all know, we get ultrasounds done routinely, and there's a report of fatty liver, and some of us get very worried, and some of us may be told by others that everyone has it. There's nothing to worry about. Of course, there's nothing to worry about, but it can become worrisome over a period of 15, 20 years. So it needs to be taken care of. There's nothing to worry about. So why is liver important? Liver is the second largest organ of the body. It weighs around 1.5 kgs. It's located in the right upper abdomen, just below the chest. It is pinkish brownish in color and has a lot of blood.
Sorry to
The
interrupt
various
you.
functions.
Sir, sorry to interrupt you.
Yeah.
Your slide is not.
Okay. Now is it changing now?
Sir, I think your video is on the front desk. Please share the slide.
Can you see the slide?
No, sir.
Okay, let me reconnect then.
Yeah.
Sir, click on share screen button at the bottom side, a green color button. More में भी है sir वो ज़्यादा का.
Yeah, that's what I.
Then click on screen. Then click on share sir. First option है sir screen. शेयर स्क्रीन पे क्लिक करेंगे तो
Yeah.
एक विंडो पॉपअप
No,
होगी.
no, I'm unable to stop sharing. Basically, that is the issue here. The slide is not.
No sir, click on share screen button. A window will pop up. Then click on first option screen. Then click on share sir.
Okay. No, I can see the slide. It's there on my screen. So I don't know if
Okay, I
sharing
got,
it again will help.
sir, can you see
I'm unable to
yourself sir?
exit the slideshow.
Can you see yourself sir?
Yeah, I can see myself.
सर क्लिक ऑन दैट, उसमें एक अपवर्ड एरो होगा सर, एक एरो होगा, उस पर क्लिक करेंगे तो जूम खुल जाएगा सर. गो टू स्लाइड मोड सर. Yeah, perfectly coming sir.
Okay.
Start sir.
Some problem with the base. So liver has multiple functions, and to simply enumerate, it destroys old blood, processes nutrients like glucose, fats, and proteins, regulates composition of blood, produces bile which helps in digestion of fats, produces protein and cholesterol, controls various metabolic processes, breaks a lot of drugs that we take for various diseases are metabolized in the liver. It detoxifies blood. It controls brain function of the brain, function of kidney, function of heart, function of lungs. So it has multitude of functions. So what is non-alcoholic fatty liver disease? It is basically a condition which liver contains more than 5% fat by liver weight. So normal fat in the liver is less than 5% of the total weight of the liver. And when this is not caused by excessive alcohol use or any other factor, then it's called non-alcoholic fatty liver disease. Being overweight or obese, having type 2 diabetes, or deranged lipid profile are the risk factors associated with non-alcoholic fatty liver disease. Coming to prevalence, 1 out of 4 people have fatty liver disease regardless of weight. Especially in a country like India or other Southeast Asia, where people generally may not weigh 80 or 100 kgs plus, but still they can have fatty liver, because as a population we do not put fat on our hips, we end up putting fat on our abdomen, which is the worst kind of fat that one can accumulate. if there are 10 diabetic patients, then more than 6 of these would have fatty liver associated with diabetes, and 9 patients who have severe obesity would have fatty liver. Men are more prone to have fatty liver than women, especially till the time women reach menopause. So this is how a healthy liver looks: brown, shiny. A fatty liver would become yellow because fat is yellow. Then there starts fibrosis or scarring of the liver. And then when the scarring continues, the liver becomes cirrhotic. That means it's structurally damaged, and sooner or later its function starts to get compromised and patient becomes symptomatic. Till this stage, there would be no symptoms, hardly any symptoms for the patient to judge that my liver is being injured. So one cannot say that I don't have a liver problem. That is why routine testing is important. So fat accumulation in the liver is fatty liver, and inflammation in the liver because of fat and which leads on to scarring is non-alcoholic steatohepatitis. Factors which lead to or are associated with fatty liver: being overweight, certain genes if one carries, food intake, because wrong food would lead us to weight gain and lead to fatty liver. Then metabolic syndrome, which includes high blood pressure, diabetes, heart disease, high uric acid, high triglycerides. Then certain medicines like steroids, oral contraceptives can lead to deposition of fat in the liver. And as food can make us gain weight, so can physical inactivity. So being overweight or obese causes fat to accumulate in the liver. Obesity increases the amount of fat to constitute 5 to 10% of fat in the liver or more. This can lead to inflammation in the liver and scarring of the liver. Diabetes and fatty liver go hand in hand. There's a threefold increased risk of death due to liver disease in patients who have diabetes. And there is high prevalence of diabetes in patients who have fatty liver. And patients with fatty liver have 2 to 4-fold increased risk of developing diabetes. Are there any symptoms of fatty liver if liver has not been damaged? Basically none, and non-specific, but some people can complain of a lot of tiredness and laziness, and there may be some discomfort or pain in right upper abdomen because of liver enlargement and enlarged liver stretching the liver capsule. Once the liver becomes cirrhotic and disease progresses further, there can be accumulation of fluid in the abdomen. There can be swelling of feet. There can be vomiting of blood or passage of blood in stool. Patient can go and develop irrelevant talking, altered sleep pattern, become comatose, can become yellow because of high bilirubin. There can be unexplained weight loss because of development of liver cancer on an underlying uh, cirrhosis because of fatty liver disease. Then how does one diagnose? The commonest modality of diagnosis of fatty liver is ultrasound, which may have been done for any other reason, and the ultrasound report says fatty liver. Once we have the report of fatty liver on ultrasound, the patient should see his or her physician initially, or a liver specialist, depending upon whom they are comfortable on going to, who may decide for various other tests. There could be some blood tests like lipid profile, sugar, thyroid, ruling out other causes of liver disease like hepatitis B, hepatitis C, taking history of alcohol. Then we have fibroscan, which we'll talk about a little later. Liver biopsy used to be done on a regular basis till, let's say, 20, 25 years back. But after the advent of fibroscan, another test which tell us about the liver biopsy is a rarity, though not out of clinical practice. Then, of course, we have CT scans and MRI, which also help in detecting liver fat, liver fibrosis, cirrhosis, and other issues with the liver. A normal LFT in a patient with fatty liver does not mean that liver disease is not progressing or there is no injury happening in the liver. because up to the 80% is a wrong figure. Up to 50% of these patients can have normal liver enzymes. And if you believe that normal liver enzymes mean there is no injury happening in the liver, then in 15-20 years, the liver may have progressed to cirrhosis and there would be nothing left for us to manage with medicines and lifestyle. And there is no designated cutoff of ALT levels for prediction of inflammation or advanced fibrosis in patients with non-alcoholic fatty liver disease. These are various algorithm tests available online to find out if liver damage has occurred and what is the extent. We put these values in a calculator and the result comes. Then, of course, we have discussed about ultrasound. It's easily available, it's very cheap, and most commonly accidentally diagnoses NAFLD. It would only pick up fat if there is more than 20% fat in the liver. Below that, it will not be unable to pick up fat. It cannot differentiate if there is inflammation or injury happening to the liver unless that disease is advanced or there's a lot of fibrosis and patient has gone into the stage of cirrhosis. Before that, it may be very difficult for the ultrasonologist to tell us how much liver damage has occurred. With the advent of FibroScan, and I'm sure a lot of you would have got it done in the past, it has become convenient and easier for us and the patient to know where exactly we are as far as the liver disease and condition of the liver is concerned. So a cap value tells us how much fat is in the liver. The cap value of less than 240 is normal. This kilopascal tells us how much liver fibrosis has occurred. Anything less than 6.5 to 7, depending upon the disease we are talking about, could be normal. Beyond that, and especially beyond 8, one needs to be careful and be in regular touch with his or her physician or gastroenterologist. It has limitations. If there's fluid in the abdomen, patient has kidney disease, there's certain liver diseases, or in very obese patients, the readings may be wrong. So one has to do various tests to come at a conclusive result. Okay, this much liver has been damaged. So there is no one gold standard where we can say that, okay, this test report is 100% right. That is why there are so many tests. This is a FibroTouch, a smaller version of FibroScan. Then MRI PDFF is the best way to detect fibrosis and fat content, but it's very expensive and a lot of centers do not have it. It costs 20,000 plus. So it's not generally used, except when the patient is a liver donor. If someone is undergoing liver transplant, to assess donor fat, this is a good modality to have precise idea. Liver biopsy hardly done unless there's confusion about the diagnosis. But one must remember, liver being 1.5 kg, the biopsy being maybe 1.5 inches, even liver biopsy, if taken from an area where the disease is less, can underreport the severity of the disease. So, if there are 100 patients who have fatty liver disease on ultrasound, 70 to 75 will continue to have fatty liver with no progression of the liver disease and no increased risk of death compared with the general population, unless they develop diabetes or hypertension or heart disease. If patient has mild inflammation, there may be some risk of progression to NASH, and otherwise 20 to 25% of patients would progress to NASH. Out of these, 11% over 15 years, but there could be less or more, would progress on to cirrhosis. Once cirrhosis sets in, there is a reasonable chance that in the next 5 to 10 years, 7 to 8% will develop liver cancer, and 20 to 40% over next 7 to 10 years would decompensate, have problems related to liver disease, and would become candidates for liver transplant. And NASH also leads to increased risk of death compared with general population because of heart involvement, other cancers besides liver cancer, and liver-related death. Once fibrosis sets in, which is even goes faster if the patient becomes diabetic. So diabetes and fatty liver together is a very bad combination to have. So NASH is a more serious form of NAFLD in which patient may have scarring of the liver. NASH leads to cirrhosis or liver cancer. So coming to treatment and management, remember lifestyle change is the hallmark treatment for non-alcoholic steatohepatitis as of now, because there is no drug which can cure the disease as of today. A lot of research is going in. We are expecting 2, 3 new drugs in next 2 to 3 years. But remember, no drug works for 100% of patients. And as of now, there's no drug which is going to work without lifestyle change. So lifestyle change includes diet, exercise, certain other changes in lifestyle, and followed by medications. So eating less, reducing your diet by 500 to 1000 calories of what you're consuming daily, and doing moderate intensity exercise provide best likelihood of sustained weight loss. Remember, obesity or overweight is a chronic disease. So whatever you do, you have to keep doing for rest of your life. Weight loss of at least 3 to 5% body weight reduces fat in the liver. If we can lose 7 to 10% of fat, it also improves inflammation in the liver and reduces chances of progression to cirrhosis. So weight loss more than 10% can reverse fibrosis. Weight loss more than 7% can resolve inflammation. Weight loss more than 5% can resolve some inflammation, and weight loss more than 3% can reduce fat in the liver. So diet wise, have lots of protein, but white meat, eggs, cheese, yogurt, right? Every day have a lot of green vegetables and fruit. Very rarely have red meat and sweets. Have more of seafood. Have plenty of water. Stop all packed foods, because either there will be too much salt, too much fat, or too much sugar as preservative. So no packed food. Avoid whatever is white. Maida, suji, chawal, chini. Stop these things. Otherwise, you cannot lose weight. Have an early dinner. Finish your dinner by 7:30. Go to sleep by 10. Wake up at 4 or 5 in the morning. That's the best you can do for your body. Coming to exercise, try and walk 7 kilometers per day. That is 10,000 steps on your phone. Even if you can do no other exercise. Exercise helps in reducing liver fat, maintains healthy weight, improves cardiovascular conditioning. Besides aerobic exercise, that running, cycling, swimming, resistant exercise is also important to build up muscles. So do 20 minutes of weight training or any resistance training. And for women who are not working or are housemakers, sweeping and mopping are very good exercises which can be done at home. Then get enough vitamins and minerals. Do your regular medical checkups. Get your sugar and lipid profile checked every 6 months. Small frequent meals, small portions. Do not fill up your plate, right? Do not talk while eating. You will end up eating more. Do not watch TV while eating. You will end up eating more. Then now coming about what molecules are approved. One must remember nothing is improved by FDA, which is the American organization which approves drugs. But Indian National Association for Study of Liver Disease recommends these 3 drugs, which we use in patients depending upon the indication. One is pioglitazone, which has been used in patients with diabetes for years. Then saroglitazole, which has been used in high triglycerides in patients with diabetes, now approved for fatty liver, to be given for 1 year. Then vitamin E, which is given for 2 years. So once we start these drugs, patient asks for how long. Depending upon the clinical trials which have been published, saroglitazole is used for 1 year, vitamin E is used for 2 years. Unless, of course, the patient has lost significant weight and his FibroScan scores become better, then we can stop the drugs. So limit intake of saturated fats and trans fats, quit smoking, exercise regularly, balanced diet, limit consumptions of white carbohydrates, limit alcohol, maintain healthy weight, take medications as prescribed. Take care of yourself. The only home you have is your body. जहाँ पर रह रहे हैं दीवारों, और वो आपका घर नहीं, घर आपका शरीर है। जितना इसका ध्यान रखेंगे उतना ही आपका ध्यान रखेगा। आई थिंक दैट इज ऑल। थैंक यू फॉर अ पेशेंट लिसनिंग। धर्मेंद्र, ओवर टू यू।
Thank you, sir. Thank you, sir, for this wonderful talk. This has enlightened us. Now we will take the question from our audience with your permission, sir. Sir, there is in the comment box, one question is asked by commonly is that when we have to consult the specialist for NASH and NAFLD.
Uh, if by specialist you mean liver specialist and not just an MD physician, then your physician is the best person to guide you. But I would say if your liver enzymes are high and they are not improving in 6 months, or if at let's say first go your physician does get a fibro scan and your score is more than 8, then you definitely need to see a liver specialist.
Okay, one other question is, sir, what is the ideal diet recommendation for this disease?
No, see, basically one has to lose weight. There is no specific diet which is better than another diet. There are a lot of fads like keto diet, Mediterranean diet. Yes, Mediterranean diet is probably better than rest of the diets, but there's no hard scientific proof. At the end of the day, we have to reduce the amount of food we are eating. As an individual person, I suggest my patients not to eat carbohydrates, which include maida. Biscuit mein maida hoga, pizzas mein maida hoga, noodles mein maida hoga. So everything is maida or rice and meatha. Cut down on these things. Have proteins and green vegetables. You'll automatically lose weight. And exercise. Build up muscle. Muscles help in consumption of more calories.
Right, sir. So, sir, on behalf of NEST 24 by 7, I thank Dr. Sudeep Khanna for this lovely and informative talk. As you have been emphasizing the awareness for the liver health and disease, it is equally important for people affected by the fatty liver to regularly visit doctors and continue medicines. With careful observation and precaution, it is possible to obtain control of the disease. So I would also like to thank our audience for their active participation and patience to making this event successful. So stay connected with the Next 24 by 7 on Facebook and take care of yourself and your family members. So thank you, sir. Thank you
Thank
very
you,
much, sir.
Dharman. Thank you. God bless you. Bye. Bye.